What is tracheoesophageal fistula and who does it affect? This is a question that has puzzled the medical world for ages. Within the vast universe of medical anomalies, one inexplicably bewildering condition stands out: tracheoesophageal fistula. This condition, with its complicated name and even more complex nature, is often a conundrum even for the brightest minds in the medical field. Tracheoesophageal fistula represents a unique malformation where an abnormal connection exists between the esophagus and the trachea. An intricate puzzle in itself, the condition manifests early during fetal development, and it's often diagnosed shortly after birth. The primary sufferers of this rare disorder are infants, thereby making it a pediatric concern. However, the condition is not entirely exclusive to the newborns, as it can affect adults as well, though in rare instances. The impacts of this fistula are far-reaching, affecting the quality of life of the individuals it touches. The most profound impact of tracheoesophageal fistula is its ability to complicate one of the most basic human processes, swallowing. The simple act, which most of us perform without even a second thought, becomes a daunting task for those affected by this condition. Each swallow becomes an act of courage, a testament to their will to overcome. Dive into the world of medical anomalies and uncover the mystery that is tracheoesophageal fistula, a condition that complicates the simple act of swallowing. Tracheoesophageal fistula, or TEF, is a condition where an abnormal connection arises between the esophagus and the trachea, two structures that should ideally remain separate in a healthy body. This deviation from the norm is not a minor glitch, but a significant medical condition that can lead to serious complications. One of the most common consequences of this is aspiration, which refers to the involuntary inhalation of food and liquid into the lungs. Aspiration can be particularly dangerous because it introduces foreign bodies into the respiratory system, which should only interface with air. As a result, it presents a high risk of infections and respiratory complications. The esophagus and trachea serve distinct functions in the body, with the former facilitating the passage of food from the mouth to the stomach, and the latter acting as a conduit for air to the lungs. An abnormal connection between these two can thus severely disrupt normal bodily functions. Interestingly, tracheoesophageal fistula often coexists with another condition called esophageal atresia. Esophageal atresia, an abnormal connection, but it occurs between the esophagus and the stomach. Much like TEF, it can also lead to serious complications, affecting digestion and making swallowing difficult. These conditions, namely tracheoesophageal fistula and esophageal atresia, usually have their roots in congenital circumstances. They're most frequently diagnosed and treated in infancy, often being detected during routine neonatal checkups. However, it's important to understand that these aren't solely conditions that affect the young. Adults too can develop tracheoesophageal fistula, though the causes are markedly different in their case. In adults, TEF can occur as a complication from esophageal or lung cancer. Infections such as tuberculosis can also lead to the development of TEF. Furthermore, certain medical procedures can inadvertently cause trauma leading to condition. This type of tracheoesophageal fistula, which is not present from birth but develops later in life, is referred to as an acquired tracheoesophageal fistula. In terms of prevalence, tracheoesophageal fistula, often abbreviated as TEF, impacts 1 in every 3,000 to 5,000 births in the United States. This medical condition is a defect in which an abnormal connection forms between the esophagus and the trachea. This connection, or fistula, is not supposed to be present, and it can lead to severe complications. For newborns affected by this, they may experience difficulty breathing and feeding problems. Interestingly, it's not only newborns who are impacted. Approximately half of the infants diagnosed with TEF, or EA, which stands for esophageal atresia, a related condition, also have another congenital condition, implying that this issue is often accompanied by other health concerns. This could range from heart defects to kidney abnormalities. In contrast, when we shift our focus to the adult population, we find that acquired TEF, where the condition develops later in life instead of being present at birth, is quite rare. Now let's delve into the 5 types of tracheoesophageal fistula. The first one on our list is type A, which is characterized by a rather unusual scenario. In this case, tracheoesophageal fistula, or TEF as it's commonly known, is absent. However, what's present and quite striking is esophageal atresia, also known as EA. So what exactly happens in type A? Interestingly, the esophagus, the tube that connects the throat to the stomach, is divided into two distinct parts. What's even more compelling is that both these segments end in what we refer to as blind pouches. Yes, it's strange, but that's the incredible complexity of human anatomy for you. This particular type is also known as pure esophageal atresia. As per statistical data, type A accounts for around 8% of all TEF cases, thus making it a significant contributor to the overall TEF cases. Moving on, we have type B. This type is a rarity, a peculiarity in the realm of TEF cases. It affects just 2% of all cases, a small number but significant nonetheless. In this type, the lower section of the esophagus ends in a blind pouch, quite similar to what we discussed in type A. However, what makes it distinct is that the upper portion of the esophagus connects to the windpipe through a tracheoesophageal fistula. Quite an anomaly, isn't it? Next up is type C. This is the most common form of TEF. In this case, the upper portion of the esophagus ends in a blind pouch, just like in type B. However, the lower portion of the esophagus takes a different route and connects to the trachea through a fistula. Surprisingly, around 85% of babies born with TF present with this type. Quite a large number, wouldn't you agree? Taking a step further, we encounter type D. This type is the most uncommon among the five. Here, a single fistula connects both the upper and lower sections of the esophagus to the trachea. This is an extremely rare scenario, with less than 1% of babies born with TEF having this type. Despite its rarity, it's an important variation to be aware of for medical professionals dealing with such cases. Finally, we come to type E. In this type, the esophagus connects to the stomach normally, as it should. However, a twist presents itself in the form of a fistula that connects the esophagus and trachea. This type affects about 4% of TEF cases. It's a small number compared to type C, but every single case counts when we are dealing with such complex medical conditions. In conclusion, tracheoesophageal fistula is a multifaceted disorder with 5 unique types. Predominantly, it's a congenital issue identified and treated after birth. On rare occasions, it may develop in adults due to specific cancers, infections, or injuries. However, no matter when it appears, the disorder has a profound impact on the patient's daily living. With grave effects on the quality of life, learning about this condition is paramount. Despite its rarity, understanding TEF is crucial, as it significantly impacts the quality of life of those affected by it.